Presentation items. So you might want to take notes on some of this stuff that we're going to go over for a little bit. And then we'll get into chapter 7. I'm sorry. All right, Miss Michelle, can you see this?
Yes.
What does it say?
Can you see?
And what else?
It's very hard to see text if the font is too small. Font needs to be a size that everyone can see, even though sitting in the back. I have really good eyes, though.
Everybody understand? Mm-hmm. So when you're presenting, your text needs to be larger than this. It should be large enough for someone way in the back to easily be able to read the text. Is that understandable? Mm-hmm. And again, these are comments, tips for you to apply within your own group projects. All right, so you want to make sure your font's big enough. All right, can anybody tell me something that's wrong with this slide? And you may not pick it up.
The number.
What about the number?
Is it in there? Smaller. It's the only one, and then you have excess.
All right, there we go. We want to make sure our slides are consistent. You don't want to have a number and then a bullet or whatever. Everything should be the same. Things should be consistent from slide to slide. So each slide should be the same. Should look the same. Same formatting. All right. You don't want too many pictures. What's wrong with too many pictures? Even if they're pretty pictures, what's wrong with that? It's distracting. Tell me more.
It takes away from the presentation.
Yes. We're going to be too distracted by the pictures. We may focus in on the pictures, may not be listening to what the person is saying. We may not read what's actually, the text is actually on the slide. So I find that oftentimes students, they get picture crazy. Too many pictures can be distracting. I'm fine with no pictures, but if you feel the need to have a picture, just keep it at one. No more than one picture per slide.
I have a question with
Yeah.
the pictures. Say they're like a PowerPoint for my public speaking.
Mm-hmm.
What do you think as far as pictures being displayed as the background of the slide, you know, and having your bullets on there? So it's just one large picture instead of having, you know, like the lines.
Oh, that's a good question. It could be okay. It depends on the picture. What you have to remember, and a general rule for PowerPoints is if you're going to have a light background, you want to have dark font. You're going to have a dark background, you want to have light font. You don't want to have yellow background and gold font. It's going to be harder to read. The take home when you're presenting is you want it to be clear, easy to read. So if you have an image in your background, you know, that may be okay, but if you do that, just make sure that the actual text that's on the slide is easy to read so that it contrasts with whatever your image is. So I'll be okay with that as long as it's easy to read. Does anybody else have any other questions or comments about basic presentation points? And I'll try to cover more presentation tips as I think of them each week leading up to your presentation to try to help you guys. But we're going to actually get into why you guys are here. We're going to talk about quality, which is chapter 7. Does anybody know much about healthcare quality? It's a topic that's becoming increasingly important, increasingly popular. Most hospitals now have their own separate quality department. So you may find that quality is an area that you want to go into and work in within healthcare management. The Institute of Medicine is a group that focuses heavily on quality and making sure that patients are receiving the best quality possible that they should be receiving. You'll see this name throughout your chapter, Donna Bedian, who many have claimed to be basically the father of quality. And according to his definition or conception of quality, he says it is made up basically of three components. Structure, which is the structure, so the actual facility, as well as your employees. The process is the actual process, the means by which we provide healthcare and services. And then outcomes. Outcomes is the third category. And the outcomes are what? What do we think outcomes are? They're basically the result of the services that we provide, right? So these are three components of quality as defined by Donna Bedian. Now he further goes into a more specific drill down where he looks at 4 particular parts that are related to quality: technical management, interpersonal relationships, amenities of care, and ethical principles guiding care. So technical management, what do you think that area is composed of? Technical management, what falls under that?
Skills.
Skills, all right, so our actual technical skills that we have, that we provide, right? So very good. And what about interpersonal relationships? This was important. I heard a guess, but it wasn't very loud.
Oh, I said like interpersonal relationships, how you treat people.
Right? More specifically,
How you treat your patients
and
your employees.
right. And why, in terms of employees, why is this important? Why is this one very important?
Well, because like what we read earlier, that good leaders, if they have decent relationships with their employees, then their employees are going to be happy employees.
All right, absolutely. And what about on a peer-to-peer basis? If you and I work together, we're both nurses, and we don't get along, what kind of quality, what kind of care are we going to be providing?
Well, I mean, it depends. Like, I don't even let relationships, like, especially if I'm working with someone, I don't even let it get that far. Like, I make them go, I'm like, look, I'm having a problem. So I really, that's the best way I can.
But can you understand how, if you have a team that doesn't get along, they're not working together, you do understand that there's a possibility that they may not be providing the best care.
Yeah.
So interpersonal relationships is directly related to quality, because we all need to work together. We all need to a certain degree, get along, at least be cordial with each other so that we can provide our patients with the best care possible, right? All right, what about our amenities of care? What falls under here? This one's going to be our facility. Is it clean? Is it dirty? Is it cluttered? Is it tight? Is it spacious? Is it old? Does it smell old? All of these factor into amenities of care, right? And they all affect the quality, right? And then the last one, ethical principles guiding care. Well, that's pretty self-explanatory. You need to have some level of ethics, right? To be able to provide a high level of quality care. So there's 2 quality questions that are very important that you should always ask. Are the right things done? That's question number 1. And are things done right? Everybody see the difference? are the right things done, which speaks to our effectiveness, and are things done right, speaks to how efficient we are. If we can answer no to either one of these, then we have to check our quality. Something's probably not right. So we need to be able to answer yes to both of these questions. So, why are we taking an entire class session to talk about quality? Why is it important? Well, it's very important. And we'll talk about kind of why. There's 3 particular areas. We have underuse, which is the failure to provide a service whose benefit is greater than its risk. An example of underuse is the underuse of beta blockers, that are related to heart attacks. Then we have overuse. This is the use of service when risk outweighs its benefits. What's this one? Antibiotics, right? Overuse of antibiotics. And then we have misuse. This one is the risk service provided badly, reducing benefit to patient. So misuse is medical errors, medication errors. So underuse, overuse, misuse. Which one's the worst? Most serious?
Misuse.
We have misuse. Anybody else? Or is everybody saying misuse? Where my nursing students at? Miss Weaver.
Underuse?
Okay, she's saying underuse. Is anybody saying overuse? Okay, so we have an overuse, an underuse, and a misuse. You said misuse.
Yeah.
Why?
It just seems like it's just more important.
More important.
When you misuse it,
Okay.
you misuse something.
And you chose underuse.
Because like the example says, the underuse of a beta blocker prescription, you know if they had a heart attack, you gotta give them a beta blocker to stop the fluids and stuff, so it's kind of like, you want to give them what they have to have for the services that you're supposed to provide, and underusing what you're supposed to provide, I think it's a great use.
Okay. And you said overuse. What are you thinking? Everybody be quiet, because she doesn't talk much. So let's see what she has to say.
I said overuse because it's a possibility of, injuring the patient, which is, I would think, a serious, problem for the facility.
Okay. All right, let me ask you another question. Which of these could cause death?
Misuse. They're all equally.
Misuse?
All of them, right? So they're all serious. The take home here is there's not one that's worse than the other. If any of these can cause death, they're all bad, right? We don't need to do any of these, right? And we went through that exercise because there are a lot of people that perceive one of these to be more serious than the other. But if any of these can cause a death to one of our patients in our hospital, we have a problem, right? So all of these are very serious. So we want to make sure that we understand the risks that each of these come with, and these exactly speak to why quality is important. Because if we are providing quality care, we aren't supposed to have these issues happen. Does that make sense?
Mm-hmm.
But the take home here is to understand the difference between each one and what could happen. Has anybody heard of the Baldrige Award before? You may not have. It's an award that's directly related or directly speaks to the quality of a hospital or a healthcare facility. It's a very good award. So if you are surfing online and you're looking at hospitals and you see a hospital that has won this award, that's a good thing. And the award has criteria, and the hospital obviously to be awarded, to get the award, they have to meet the criteria. And here are the things that the criteria are made of. So somebody tell me what the number one thing at the top of the list is. If you can see it, hopefully you can see it. So we've seen this before, right? What does this mean? What do you think it means? Somebody has an idea, but they're afraid to say it. Yes. So the people that award these hospitals, the first thing they're going to look at is what is their strategic framework? What is their mission? What is their values? What are their vision? Does their mission say to provide our patients with quality care? Or does their mission speak to quality in some type of way? Does their vision speak to quality care in some type of way? Do their values speak to quality in some type of way? So here we see it again, how important our strategic framework is. It grounds us in everything that we do within our organization. So they look at the strategic framework. They also look at the structure. So they look at the leadership. Is the CEO, is the president heavily involved in the quality goals of the organization? Do they emphasize quality care? Again, here's strategic planning again. Does the hospital have a strategy in place that involves quality? And what's the focus of the hospital? Is there focus on patient outcomes, patient quality, those types of things? So all those things fall under structure. So they look at that. Next, they look at the process. What are they actually doing? So they look at the staff focus. What might be, if I'm on the committee, the Baldrige committee to award hospitals, what types of staff focused things might I see that might show me or tell me that this hospital is really on top of it when it comes to quality? What do you think? And you may not know. If I'm in a hospital and whether I'm a patient or I'm just a secret shopper or whatever, I may be, and I'm walking around from floor to floor, a hospital that has a staff focus on quality will probably have goals up on the wall, posted, what their metrics were last month, what their goal is for this month. It may have a poster highlighting Ms. Jeanette, who had a 100% quality metric that she met last month. Those are the types of things that exhibit staff focus, right? So they're checking for the staff focus to see if the staff is focused on quality. And they're also looking at process improvement. So let's say we didn't give all of our beta blockers last month, but what are we doing to improve that? What plan or process do we have in place to make sure that this month we do give those beta blockers when we need to? So they're gonna look at the process improvement. And then obviously they're gonna look at outcomes. How many misuse outcomes have we had? How many overuse outcomes? How many medical errors have we had? So they're looking at your outcomes. And then the last thing they look at is how you're measuring this stuff. So you say that you give out beta blockers. How are you measuring this? Where are the numbers? Where's the hardcore data? So they're gonna look at how you're gathering all of your information, how you're gathering your data to make sure that you are hitting those quality metrics. So they look at each of these categories within a hospital, and obviously if a hospital is doing really well in all these categories, their chances of winning this award go up really high. So again, if you're out surfing online, looking at hospitals, maybe your grandmother's sick and you have to find a hospital to take her to. If you see a hospital that has won this award and you're comparing it against a hospital that hasn't, I'll probably send in my granny here, right? So this is a good thing. A very highly coveted award related to quality. And this diagram is from your book, and it kind of goes over what we just talked about with this award and the criteria. And here are the different components. So you have leadership, strategy, how you focus on patients, how you measure it, your staff focus, process management, and your organizational performance results. All right, so I want to talk a little bit about some common elements related to quality. As I just talked about, when it comes to quality, measurement is very, 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 very important. Why do you think measurement is important as it relates to quality? If we say we're good at something, but we have no way of showing it, who's gonna believe us? Nobody, right? If I say I'm the fastest, I can run faster than any other faculty on this campus. If no one's clocked me, how do you know I'm telling the truth or not? Right? Or if you haven't, clocked me racing against another faculty, it's just all talk, right? So when it comes to quality, it's kind of the same thing. We have to make sure that we understand that measurement is very, very important. We have to measure everything because, again, we're talking quality, so we're talking care, we're talking possibly lives saved. So under measurement, the first thing we have to do is define it. We have to define what we're measuring. If we haven't defined what we're measuring, we're not really measuring anything. We don't know what we're measuring if we haven't defined it. Then we have to make sure that it's reliable, that the thing that we're measuring is reliable. So if I keep on the same example of me being a fast runner, I don't know how I came up with that example, but, and I have a stopwatch, or you have a stopwatch, and it works sometimes and it doesn't, it's not reliable, right? So we have to make sure that not only have we defined what we're measuring, but we have to make sure that it's a reliable means, something reliable that's going to work every time that we measure it. And then we also have to make sure it's valid, right? Which means it's relevant. So if we're talking about running and somehow jumping gets into the conversation, how valid is that? It doesn't have anything to do with what our original measurement was, speed, me racing, right? So again, measurement, have to define, has to be reliable, it has to be valid. All these things have to check off. And quality also, when you get deep into it, and again, this is something that more so people working specifically in the quality department will be doing. They also do a little bit of statistics, data management. So again, if you're working directly in the quality department, you'll have a lot to do with numbers, measuring, defining reliability, statistics. But if you are a manager in a department of another area, but you still want to know your quality numbers, you'll come to the quality department to get assistance with them helping you to analyze your department data. All right, so we should all understand that no one's perfect, right? We all make mistakes, and what that means is we always have the opportunity to get better. So you will find that continuous process improvement is a common term in quality because as a healthcare organization, we are always seeking to find ways to get better. How can we provide even better care than we're already doing? That relates to process improvement. There's 5 dimensions to process improvement, and they are process focused. So we want to look at our process, how we're doing things, where can we improve. Our customer focus, how can we improve our patient satisfaction and our focus on patients. Our database decision making, how can we improve looking and analyzing the data that we've received and making decisions from that. How can we make that process better? And employee empowerment, how can we empower our employees to make them feel encouraged or motivated to provide higher quality? And organization-wide scope, so how can we as an organization as a whole improve to provide better quality for our customers or our patients? One way, or one metric that is used in process improvement, continuous process improvement, is, they call it focus. And obviously this is an acronym for find, organize, clarify, understand, and select. So first, we have to find. which means we have to identify what our problem is, whatever it is we want to improve or fix. And then the next thing we're going to do is we're going to organize. So we may put together a special ad hoc team or a special projects team to work specifically on this issue. Let's stay with the example of beta blockers. So we've identified that there's an issue where beta blockers are only being administered 50% of the time, when it should be higher than that. So next thing we'll do is probably put together a team to look closely at that, to see what's going on, see why our patients aren't getting their beta blockers. And then our next step will be to clarify. So we're going to use techniques to clarify the problem. Now here there's a little bit of variability as to what you do. These are just two examples of things you could do to clarify, but there are other examples. So it could be, maybe we survey. Maybe we actually go around and physically talk to the physicians and say, you know, for this patient, why wasn't a beta blocker administered? Or we could, you know, physically flow chart or see what's going on from when the patient enters the hospital to when they leave. There's all different types of ways that we can clarify to try to get techniques to get more information about the problem. The next step is to understand. So here at this step, we're going to measure and collect the data. So this is the step where we would look at all of the beta blocker instances to see what's going on. And then the last step is select. Once we've come to a conclusion as to what's going on, the next step would be to actually implement those improvements, whatever they may be, whatever we come up with. So that's focus. Now a similar, very similar technique to focus is called PDCA, which is plan, do, check, act. With this one, we're planning, so we're putting in an implementation plan in place. Next, we're actually doing the plan, we're implementing it, and then we're going to check the plan to see how it's going. Is it going well? Is it not going well? And then, depending on how our check comes out, is how we'll act. If the plan is going well, we'll continue to do that. If the plan is not going well, we'll go back to the drawing board, revise it, redo it, to try again. So focus and PDCA are both techniques that relate to continuous process improvement. So ways that we are continuing to improve for our patients and for the quality of their care. Has anybody ever heard of Six Sigma before? It's another quality technique. Six Sigma is actually very popular with companies like Toyota. So Six Sigma is not something that's just used in healthcare. It's a technique that's used by all different industries. And the intent of Six Sigma is to make companies and people more efficient. So how can we do things more efficiently? How can we shave off time? How can we be resourceful, but obviously still provide high quality of care? Six Sigma and process improvement is another area within healthcare that's growing pretty fast. And it's an area that you can get certified in. They have all types of Six Sigma certifications. If you find that process improvement is something that you're really interested in, they get paid pretty good. So it's definitely a growing area that's directly related to quality and improving processes to make organizations run better, more efficient. And then we have one last acronym that we're going to talk about today, DMAIC. Define, measure, analyze, improve, and control. So again, as we talked about before we do anything, we always need to define. Figure out what it is we're doing. So first we have to define. And then we want to measure. So we need to create what type of metrics we're going to use to measure. And then we have to analyze. So we want to look at the process and look at exactly what's going on. And after we figure that out, then we can look at how to improve. What steps do we need to take to make improvements so that we can meet our goals? And then the last step is control. Control is important because we're not just done after we improve. We have to make sure that we can continue to improve, and we can only do that through control. So that's pretty much all I have today about quality. It's not a very complicated technical chapter, but it is something that's very, very important because, you know, when we go into the hospital or when our loved ones go into the hospital, we obviously want to make sure they have the best care, right? And if a hospital is not performing at a level of high quality, we're basically putting our lives in their hands, right? So it's very important that you understand that quality plays a big role in the function and the process of healthcare organizations. And even if you don't work directly in quality every day, it's important for you to know what they do because it's related to every single department in the hospital, not just the clinical ones, but non-clinical ones as well, because if we aren't providing good quality, we won't get patients. And if we don't get patients, some of us are going to be out of work, right? So does anybody have any questions about quality or comments or what we talked about today? Hopefully you guys learned something, because when we started this, no one really said that they knew much about quality. So hopefully you took something away today, learned something. And if you guys don't have anything, then that's it. I'll see you guys on Thursday.